oral, eye, and ear checkoff medication administration. Review MAR for the 5 rights.
All right, I'm going to give Michael Wagner his Lenaxin 0.25 milligrams oral daily at 8 a.m. He's also going to get Timoptic ophthalmic solution 0.25% 1 drop in the right eye daily at 8 a.m. and chloromycetin addict suspension for Michael Wagner 2 drops right ear daily at 8 a.m.
Verify allergies.
He has no known allergies.
Research information about each medication. Gather equipment, gloves, correct medication, medication cup, glass of water, and straw. Perform hand hygiene. Calculate and correctly prepare accurate dosage of each medication to be administered.
Okay, I have Michael Wagner, and my first med is going to be Digoxin. I have Digoxin, and it's Lenaxin 0.25 milligrams. I have 0.125 milligrams, so I'm going to have to do a calculation. It's oral as a tablet, daily at 8 a.m. And then I have Michael Wagner, Timoptic ophthalmic solution 0.25%. I have Timoptic ophthalmic solution 0.25%. I'm going to give 1 drop in his right eye daily at 8 a.m. And then I also have for Michael Wagner, chloromycetin addict suspension. I'm going to give 2 drops in his right ear, daily at 8 a.m. That's my first check. And since I have Dig 0.125, I need to get another Digoxin 0.125, which will equal my 0.25. So I have Michael Wagner, I have Digoxin or Lenaxin, Each tablet is 0.125. I have 2 0.125 to equal 0.25 tablets oral daily at 8 a.m. And I need to check an apical pulse with that. Alright, and then I have Michael Wagner. I'm going to give Timoptic ophthalmic solution 0.25%, 1 drop. I'll give 1 drop, right eye daily at 8 a.m. And here, 1 drop right eye, so I don't forget. And then I also have Michael Wagner, chloromycetin addict suspension. I'm going to give 2 drops in the right ear daily at 8 a.m. Alright, good to go.
Oral medication administration. Perform hand hygiene. Introduce self and identify patient by 2 patient identifiers: name, date of birth, medical record number.
Hi, my name's Cheryl. Can you please state your name and birth date for me?
Michael Wagner, 000000.
Provide for privacy. Conduct any necessary pre-administration assessment.
Okay, Michael, I need to check your apical pulse before I give you your medicine. You're 90, so we're okay to give your medicine.
Explain purpose of each medication to patient.
We're going to give you your heart medicine and your ear drop and your eye drop for glaucoma and your infection.
place patient correctly for oral medication to be swallowed.
Just gonna put you up, and I have a glass of water with a straw for your pill. Before I do that, I'm gonna go ahead and do your third check just to make sure I have all your meds correct. So I have Michael Wagner. Michael Wagner we verified. We're giving Digoxin, Noxin. I have 2 that say Digoxin, 0.125. I have 2 1.25 milligram tablets. So I'm gonna give 2 daily at 8 a.m. And then I'm gonna go ahead and give your Timoptic ophthalmic solution. Michael Wagner, Timoptic ophthalmic solution, 0.25%, 0.25%, 1 drop. I'm gonna give it in your right eye, and that's due at 8 a.m. And then I have for Michael Wagner, Chloromycin otic suspension. I'm gonna give 2 drops in your right ear daily at 8 a.m.
Administer medication as per patient's tolerance.
Okay, Michael, I have these pills for you. You take it and swallow it with some water.
Remain with client until oral medications are swallowed. Eye medication administration. Warm eye drops and ointments between the hands if not stored at room temperature. Don clean gloves. Place a rolled towel or pillow beneath the neck if needed. Position the client supine or sitting with the head tilted back and slightly to the side into which the medication will be instilled. Clean the lids and lashes if they contain debris. Wipe the eye from the inner canthus to the outer canthus. Instruct the client to look toward the ceiling. Make a pouch in the lower lid by pulling the skin downward over the bony orbit. Move the container of medication from below the client's line of vision or from the side of the eye. Instill the prescribed number of drops into the appropriate eye within the conjunctival pouch. If using ointment, squeeze a ribbon onto the lower lid margin. Instruct the client to close the eyelids gently, then blink several times. Wipe any excess medication. Remove gloves. Ear medication administration. Warm eardrops by holding them between the hands if they have not been stored at room temperature. Don clean gloves. Place the client on the unaffected side in bed, or if ambulatory, have the client sit with head well tilted to the side so that the affected ear is uppermost. Draw up the amount of solution needed in the dropper. Do not return excess medication to stock bottle. A prepackaged mono-drip plastic container may also be used. Straighten the auditory canal by pulling the pinna up and back for an adult, down and back for a child. Hold the dropper in the ear with its tip above the auditory canal. Do not touch the dropper to the ear. Allow drops to fall on side of the canal. Release the pinna after installing drops. Have patient maintain the position to prevent escape of medication. Wait 5 minutes if instilling in the opposite ear. Gently press on the tragus a few times. If ordered, loosely insert a cotton ball into the ear canal. Reposition the patient for comfort as needed and maintain a safe environment. Remove gloves and perform hand hygiene. Record all medications administered per facility policy, including pre-administration assessment data. Evaluate the patient's response to the medication within an appropriate time frame and document per facility policy. Maintain proper body mechanics throughout the procedure and maintain patient safety during the procedure.